Many of our viewers are watching tonight's debate online, and News on 6's Jonathan Cooper joins us now from our digital desk with a question from viewers. Jonathan?
Craig, thank you. We've received a lot of great questions from viewers through Facebook and through our text line as well. But I want to ask specifically about health care. And Maria asks this. Maria says that I'm retired and on a fixed income. Today, President Biden signed the Inflation Reduction Act. As part of that bill, the federal government can now negotiate the price of expensive prescription drugs for people on Medicare and limit the monthly cost of insulin. Do you think this will help Oklahomans? Mr. Frix, we'll begin with you.
You know, as I've seen them passing, just because they name a bill something doesn't necessarily mean that it does what they've named the bill. You know, we saw the passing of the Affordable Care Act. They said that was going to make health insurance and health care affordable to all Americans. What did we see after the passing of that? Our health insurance costs went up, our health care costs went up, and they continue to go up every single month. And now they passed the Inflation Reduction Act, which is nothing but hiring 87,000 more IRS agents to go after hardworking Oklahomans like you and I. I mean, it's not going to address inflation. We know that what caused inflation was more government spending. And so what did they do in this bill? They spent even more, and then they said, we're just going to title it the Inflation Reduction Act, and that's going to get rid of inflation. Absolutely. It didn't work with the, absolutely not. It didn't work with the Affordable Care Act. It's not going to work with the Inflation Reduction Act. And I'm proud to stand up and fight back on that. We've got to stand and fight back to truly get health insurance costs down. We've got to get the government out of the way. Just like I said in small business, we got to get government out of the way. For health care, the more government's involved, the more our prices go up.
Mr. Brecheen.
So more government is not the solution for the health care issues. 15, 20 years ago when I was working for Tom Coburn, he was talking about catastrophic loss insurance, high deductible policies. If you want to know the problems in healthcare, watch every time the government does something that increases the cost. In 1960, 50% of all healthcare purchases were retained, risk retention, meaning that when you bought something, you actually cared about the cost because you had part of the cost, 50% of it, that you actually paid out of pocket. Today, it's only 10%. Healthcare is one of those few purchases that we make where we're not concerned about quality and cost. Free market solutions is how we restore sanity to these runaway costs in healthcare. I'll give you one last example. I had a procedure with my wife. $500 was the cash price. We paid it. Got a bill, they didn't know we'd already paid it. $7,000 was the insurance cost.